Tonight's special segment, Stopping Spider Veins. Millions of women suffer from the unsightly common condition, but now a new tool used with one of the most common procedures currently done may make that treatment even more effective. Health Beat reporter Sylvia Perez has the story. Sylvia?
Ron, women will go to great lengths to cover up spider veins and spend a lot of money trying to erase them. But now doctors have a new technique allowing them to see the problem in a whole new light. On this cold, snowy Chicago day, when layering and bundling up is key, Tammy Notice has visions of summer and wearing bathing suits and shorts. It's a thought that she used to dread because of her spider veins. Today, she's going to the doctor to get rid of them.
Now is the best time to do it. Then that way it's all taken care of by summer.
Spider veins are dilated blood vessels located close to the surface of the skin that have a red or bluish color. They can appear anywhere on the body, but typically occur on the legs and face. They can develop during pregnancy or just be hereditary. One of the most common treatments used to get rid of them is sclerotherapy. It's basically an injection directly into the tiny vein with a solution that causes the vein to disappear or appear lighter in color after several weeks. For most patients, sclerotherapy is very effective. Here's a before and after of one patient after 5 treatments. But now this device can shed some light into what might be the real cause.
I've been treating spider veins by injections for over 15 years, and this is really the biggest breakthrough development that I've seen.
Dr. J. Gordon Wright says the special light allows doctors to actually see under the surface of the skin without any cutting. It's called the Veinlite, and with this tool, doctors can locate the so-called feeder veins.
There are often feeder veins that are just a few millimeters under the surface of the skin that are not visible on the surface. It makes the treatment more difficult, and it makes the chances of a recurrence much, much higher.
But Dr. Wright says the Veinlite makes sclerotherapy more precise, meaning fewer injections, and the spider veins are less likely to come back.
Because instead of individually injecting a bunch of branches that we can see on the surface, we can sometimes make one injection to a feeder vein and treat all of those branches that we would have had to do several more injections on.
And fewer injections mean less discomfort for the patient. But Barbara Borden says it's really not that bad.
It's no more than a little bee sting, just initially, and then it's over.
It usually takes 3 to 6 weeks for patients to see the results. Tammy Notice is pleased with the outcome.
The spider veins have disappeared. I haven't had anything reoccur from the treatments that I've had.
Some doctors question whether tackling these so-called feeder veins really makes a difference. Dr. Wright hasn't been using the Veinlite for very long, but says as time goes on, he expects his patients will likely notice better long-term effects. And finally, anyone getting sclerotherapy should do it during the winter because the treatment can initially make the veins appear worse before they get better. The cost is about $250, and you usually need 3 to 4 sessions. If you want more information, you can log on to our website, abc7chicago.com. Ron and Kathy.
Thanks, Sylvia.